Okay, Zoe, I'm so excited to have you here. You had cholestasis with your first pregnancy and bladder prolapse. And spoiler, you did not have it with your second. So I really am excited for you to share that experience, the first one and the second one, especially as being a health coach that specializes in pregnancy and postpartum. So, one, I just want you to describe your first pregnancy experience and cholestasis, how that came about, and then your bladder prolapse postpartum.
Yeah. Well, thank you for having me. I'm so excited to be here. So, my first pregnancy was pretty smooth overall. It was pretty great. Wasn't super nauseous in the first trimester, had a little bit of, your typical pregnancy symptoms, but it was pretty smooth. And then around 28 weeks, my belly started getting insanely itchy. And I'd always heard,
Mm.
like, okay, itchiness is totally, normal in pregnancy. So, I didn't really think much of it because it was around the winter time as well. So I was like, okay, heaters
Dry,
on,
yeah.
my skin's dry, that whatever. But then it did not go away and it started to get unbearably itchy where I couldn't sleep. It was pretty awful. So finally I got some blood work done and was officially diagnosed with cholestasis around 30 weeks. And that's
Okay.
when my entire birth plan went out the window. I had gone into my first pregnancy thinking I was under the care of an awesome midwife group that was affiliated with a hospital. They were great, and my birth plan was like, okay, I wanted to be with this midwife group, but it was also at the hospital, just in case. Then when I got diagnosed and was told I needed to get induced by 37 weeks.
Oh, yeah, can you pause really quick and
Yeah.
just say what cholestasis is and why it's so dangerous?
So first, let's talk about cholestasis. Cholestasis, for those that don't know what it is, it's a rare liver disorder that occurs in pregnancy and can cause complications for both the mother and the fetus. And the risk of stillbirth goes up.
Mm,
It increases after that 37 weeks. That is not something that we mess with. One of the main markers to get diagnosed with cholestasis was that itchiness symptom. They took lab work to check my bile acid levels. And with bile acid levels, I believe the marker has to be either under 10 or 11 for pregnancy, and mine was above that. Mine wasn't super high. Some people have numbers that are in the hundreds, and mine tended to stay around 20 or so. So it wasn't severe, which was great. But at the same time, the conservative approach at the hospital was induction at 37 weeks. My entire birth plan went out the window, and I had to very much mentally prepare. I'm glad I found out that early because a lot of times people don't find out until 37, 38 weeks. And then they're told, we need to go to the hospital right now. And they have no time to mentally prepare. They're just have to go straight into getting induced. So I'm thankful that I did find out earlier because I had time to mentally prepare and to
yeah.
change my birth plan with my doula.
So since you did find out early, did they tell you, like, any herbs or lifestyle? Or did they say there's, like, anything you could do?
Not much, surprisingly. So it was primarily focused on the tips were primarily focused on managing the itchiness. So it was talking about, take baths and have, kind of like the oat baths and things that you would do maybe for eczema or dry skin, like
Okay.
that kind of itchiness care. And then also just maintaining a liver friendly diet. So those were the two main things. And that was to really just support my liver and to manage that itchiness symptom.
Okay.
Um, a doctor that I know did give me the advice to also incorporate some apple cider vinegar here and there
Okay.
in my diet, which also helped balance out that itchiness and my bile acid levels.
Alright. So then you went to the birth, and then how did you end up with bladder prolapse?
My induction it was kind of a crazy 4-day process. It was not a short process. I was there for a very long time.
Oh my
Yeah,
gosh.
yeah. Luckily, I had a very patient care team, and they let me be there for 4 days to
Yeah.
get induced rather than telling me I just had to go get a C-section. So I'm very thankful that they worked with me and were very patient in that process. And I ended up getting an epidural, and during the epidural process, because I had labored naturally for hours with the pitocin and all of that, and finally, I was just so exhausted. I mean, after 4 days, I just was exhausted, and so I got an epidural and needed that little break, and when I got the epidural, all of a sudden I realized, "Wait, I can't feel anything." And I had never prepared
Totally.
for pushing with an epidural because my entire birth plan was to do it as naturally as possible. So I don't know if it was the way that I pushed or if I would have just had a bladder prolapse regardless of what happened. But I ended up having a bladder prolapse, which I also had heard nothing about. No one had
Yeah.
told me that was a thing. So about 6 weeks postpartum, I started getting this symptom of feeling like there was a tampon halfway. I finally had my pelvic floor physical therapy appointment and was introduced to the world of prolapses. And I was
Wow.
told that I had a bladder prolapse and a little bit of a rectum prolapse as well.
Oh my god.
And I spiraled along with, all the postpartum hormones and everything. It was just a lot. Like the whole experience from the
So,
induction and this, it was a lot.
how did they tell you to, like, take care of it, like, to heal from it? Like, what was your instructions?
Yeah. So I did a lot of pelvic floor physical therapy
Okay.
appointments and it
Okay.
really helped manage my symptoms. I was told that it would not necessarily heal the prolapse, but I could totally manage the symptoms of pelvic floor physical therapy, which I was able to do. So I would say over the course of about 6 months, like it took some dedication and prioritization on my end to do the exercises that they told me to do to strengthen that whole pelvic floor area.
Yeah.
And it took about 6 months to really get to a place where I felt like I could go on a decent walk again and not feel that.
Wow. And then, like, worst case scenario is, like, surgery?
Worst case
Fixes?
scenario was that it would continue to get worse and, continue to get that falling feeling.
Yes. Yeah, I can
You
totally
can.
picture it.
And yeah, and there's, a couple different things that you can do, but at the end of the day, it would be like, I think surgery would be the last option, but an option if it got to be that severe.
Alright, so then now
Mhm.
fast forward to your second pregnancy. Like, were you told that, like, now that you had cholestasis once and you had bladder prolapse, then did they say you're gonna have this again or that you could avoid it? Like, what were you told by, like, your doctor? Like,
Yeah.
what
So I was informed that from all my healthcare providers that there was over a 60% chance and as high as a 90% chance of developing cholestasis again. And for the prolapse, I was also told that it would probably either remain the same or potentially worsen with subsequent pregnancies. So that was super overwhelming to hear, knowing
okay.
that was my first pregnancy and I did want, one more child.
Yeah.
So the odds were not in my favor to say the
Yes, okay. So then you get pregnant and you decided to hire a midwife and go for a home birth route. Like, why did you decide that? Like, how many midwives did you interview? Why did you pick the one that you picked?
Yeah.
But
So it actually was not intentional. I was not planning on doing a home birth my second time, but the midwife group that was affiliated with the hospital with my first, they shut down just due to budget cuts at that hospital. And I found that out the day I got pregnant. It was the
oh
day
my
that they shut
god.
down. And I
What a
took that
sad
as
thing to cut.
so yes, it's very sad that it got cut for me personally in this pregnancy. I took it as a sign that, hey, that wasn't
Wasn't
meant to
yeah.
be this time. This story is going to be a different story to tell. And maybe I just go and try the home birth route. So I kind of took that as my sign of like, okay, let's try something different, setting honestly no expectations at all, knowing that again, the odds were not in my favor. So knowing that the likelihood of getting induced was going to be high, but
Yeah.
might as well try. So my doula from my first pregnancy, she gave me some recommendations for midwives. And she said,
Okay.
knowing what I know about you, this is going to be a great fit, not only personally, but I have this great recommendation. Nina, she is so experienced in herbal medicines as well. And, herbs are her forte. And I think if anyone can help you have the tools to help prevent cholestasis, it's her.
Okay.
And she was the first person that I had interviewed. And it was, yep, sold. We just, clicked from the moment that we met. And then I truly loved, all that she had to offer in terms of herbs and every sort of natural remedy and prevention tip that she had in technique.
Yeah. So then knowing your previous pregnancy and birth experience, did she confident? Did she have a plan or did she have expectations for you to be like, okay, we're going to try this, but it may not work and you
Yes.
might have to get induced?
I think what I appreciated the most was that she set no unrealistic expectations. So instead, I would say she actually empowered me to truly trust my intuition and focus on the process. We developed a flexible plan from our first meeting with several options. There was, plan A, plan B, plan C, depending on if I got cholestasis, also the week of gestation. And yeah. And then for my prolapse, she really emphasized the importance of postpartum recovery. And that was where it was that early postpartum healing, that particularly that rest time in those first 40 days were going to serve as my foundation for really resetting my body and my organs. So that was our main focus, was going to be, that postpartum prep.
So then what types of things did you do to support like your liver this pregnancy?
Yeah. So I did a few things, and these are all things that I did not necessarily that I didn't do in my first pregnancy.
But
Yeah, you never know, but I do think it made a difference regardless of how I felt during pregnancy. And I do think it played a part for sure in the prevention of cholestasis for me. So for my liver, I drank dandelion root tea every
okay.
day. Nina also made me different concoction with a bunch of herbs for a special blend of tea that always had dandelion root in it. I took beef liver supplements, which I
Oh
had
yeah.
stopped prior,
Yeah.
uh, just supporting my liver there. I also prioritize making homemade bone broth a lot, especially I was very nauseous in my second pregnancy. And that was really a good way for me to get some protein in the morning because all I craved was bagels and toast.
Totally. Of course.
So prioritizing making bone broth and having the energy to do that, I think made a huge difference throughout my pregnancy. And I just started becoming in love with drinking that bone broth. It became my warm cup of something in the morning that was a habit that I'm still doing to this day. I would say prioritize exercising for at least 15 to 20 minutes every day, even just taking my dog on a good walk, and then sleep, of course. Most importantly, I really taught myself and was very mindful about having a flexible mindset about the outcome.
Mhm.
That's the hardest part, is that
Oh, yeah.
and setting no expectations while trusting the process at the same time. It's not easy for me to do. So
Oh,
that's something
yeah.
I've done every day.
So then, and obviously, I know you said you were more nauseous in this pregnancy, but overall, like, I mean, you felt pretty good on the first one, but then, like, did you continue to do like blood work throughout the whole pregnancy and like on top of what you normally do to test your liver
Yeah.
and your
So
bile acids?
I tested my liver, just my normal basic liver function throughout my pregnancy, just to make sure all of that was working well. We did not test my bile acid levels because I never got those itchy symptoms again.
Got
So
it.
that was going to be if I got
Oh, I
any
see.
symptoms, we would test those again. So I did not have to do that.
Okay, so then you went through this whole pregnancy and then you went into labor naturally. At how many weeks were you?
Yeah, I was 40 weeks, and I was 40 weeks when I went into labor, and my daughter came at 40 weeks and 1 day by an hour or by a couple hours. So she was right on time. It was a smooth and short and fast labor and birth. And I think everything that I did for preparation was what made it what it was. My water broke, and within 3 hours, I had given birth to her in our bathtub at home. So that was
Wow,
super. It
that's
was,
amazing.
yeah.
And then how did your bladder feel like right after birth? Did it feel like a mess or did it?
Yeah. So I didn't really. Okay. So going back, my midwife had stressed, right? The importance of staying in bed. Also, the house that I live in has 4 flights of stairs, very, very
Yeah.
long,
Yeah, I've been to your house.
very long flights of stairs. So my midwife had stressed the importance of, okay, well, stay in bed and stay on the same floor. Let's avoid the stairs as much as possible in those first 40 days and give my body a chance to heal and my bladder a chance to move back up and reset. And the importance of postpartum is also a time to reset. Your body can truly reset in that time from each pregnancy. It doesn't
Right.
happen the same as previous pregnancies, which was so brand new to me. So I set up the time to create a true support system. I had my husband, my nanny, my mom, my mother in law, I had everyone, a great support system that helped with meals. I also ordered a lot of mama meals. I made a lot of meals for myself,
Yeah.
for my toddler to make it easier for whoever was caring for him and really allowing me to focus on that recovery time frame. So then once I gave birth, it was basically just me and my newborn in bed, for the first week. I pretty much did not get out of bed. And then for the 2 weeks after that, we stayed in and around my bedroom. Like the farthest I would go was down the hall to my son's room to say good morning to him and things like that, or to do bedtime with him. So I think in the first 40 days, I counted, I think I left my house twice total and just even went outside twice total in 40 days and stayed in and around our bedroom the entire time and walked up and down the stairs less than 10 times.
I mean, it's like so simple, but so not easy. It's hard to do.
And it's not in my personality to give up
Yeah.
control over everything in the house. So every time I would get antsy, which was quite frequently, my husband and my midwife would make me get back in bed. They would truly like shove me back in bed. And say, no, we need you to have this time to heal properly because we need you healthy,
And you're
rest
glad
of
that
the
you did that, I'm sure. And how many months postpartum are you right now? 5. And how does your bladder feel? Like, how does things feel?
fantastic. It
Wow.
worked. I had my first pelvic floor PT appointment around 7 weeks this time. My therapist confirmed that my prolapse was barely a grade 1 when it had been a grade 2 with my first. So it improved by a whole grade, which was fantastic. And I don't have any symptoms, which
Oh my god.
is honestly life changing. Yeah.
Wow. I mean, like, to have to go through 2, like, really challenging things the first time and then be told, like, this is basically gonna happen again, and then to avoid both of them the second time, that is insane. Lifestyle choices, and the herbs and the beef liver and stuff, I mean, that's so incredible.
It truly was quite the opposite pregnancies, or birth
Yeah.
experiences, I would say, and postpartum experiences. And I'm grateful I had both because I learned so much from both experiences. I feel like I've already been able to help so many other people in lots of different ways because I was able to have a lot of experience having all the interventions versus having no intervention. I think it truly also speaks to, right, that every pregnancy and every birth story and every child and baby comes into this world very different and everyone has their own story and you could have 4 pregnancies and they could all be completely different. Yeah.
Did you do anything during your pregnancy to help with your bladder, like belly support bands to, like, lift the weight or anything like that? No.
I did prioritize exercise and just making sure I didn't let that pelvic floor strength go. So I
Got it.
definitely concentrated on that. I would say that's probably the main thing that I did.
What advice would you give to someone who has previously had cholestasis or some sort of prolapse that is worried they might have it again?
Yeah, my advice would be that every pregnancy is unique and just because something happened to you once does not guarantee that it will happen to you again and doesn't have to be. Choosing a healthcare provider who aligns with you, your values, your needs, and will empower you throughout that process is key. And that's something that I think made a huge difference and something that I would totally encourage anyone to do is making sure that you prioritize the right healthcare provider for you and your family. And last, I would say
Yeah.
trust your body, stay flexible
Yeah.
with your expectations. Pregnancy has definitely taught me that you are truly never in control of anything.
Yeah.
Great lesson in life. And, do what you can to control what you can control, right? Which for in this case is preparation and support. And so whatever you can do to prepare and get the support that you need, it can make all the difference.
Awesome. Well, thanks for coming. I'm so glad that you got to share that story because I know you outside of this. And it's so cool that you had that experience. Well, not cool that you had the experience, but it's cool that you had it and then were able to change the story the second time. And more people need to know about this, that they can change their story for the next time.
100%.
So, yeah, thanks for coming.
Of course. Thank
Yeah.
you so much for having